Theophilus Training College,
This call is now being recorded.
Dr. Bindu ma'am, the constant motivator and a pillar of support for us, Dr. Jojo John sir, teachers, mentors, research scholars, and dear participants. We, the research wing of Theophilus Training College, welcome you all to the 61st session of our program, Insight Indepth. Theophilus Training College has always been a source of inspiration for gaining knowledge. Apart from teacher training, the college has organized many state, national, and international seminars and webinars. Insight Indepth is yet another milestone of the college. Let us now begin today's session by seeking the blessings of Almighty with prayer.
വിശ്വമെങ്ങും വെളിച്ചം പരത്തുന്ന വിശ്വനായക ദൈവമേ കൈതൊഴാം വിദ്യയ്ക്ക് ജീവിതയാത്രയിൽ വിദ്യരാക്കി അനുഗ്രഹിക്കണമേ വിത്തവും ചിത്തശുദ്ധിയും ബുദ്ധിയും വൃദ്ധി നേടുവാനായി കനിയണമേ മിത്രസമ്പത്തും കീർത്തിയും ഞങ്ങളിൽ ചേർത്തു പാലിച്ചു നന്മയരുളണേ ഹൃദയത്തിൽ നിറയുന്ന ഭക്തിയും ദത്തമാവാൻ കൃപ ചൊരിയണമേ സത്യധർമ്മ പദങ്ങളിൽ ഞങ്ങൾക്ക് നിത്യവും തുണയാകണം ദൈവമേ സത്യധർമ്മ പദങ്ങളിൽ ഞങ്ങൾക്ക് നിത്യവും തുണയാകണം ദൈവമേ.
I now invite Mrs. Soumya DE for the welcome address.
Good evening, one and all. Respected principal, our research distinguished. Our
Soumya, you cannot be heard, Soumya.
now, hello.
It is better, but if you could speak a little more louder, that would be great.
Okay, ma'am. Audible?
Yes, Soumya. Please continue. Thank you.
Okay. Welcome to yet another session of Insight Indepth 61st Talk Series organized by Theophilus Training College Research Wing, Ignacia. With thankful heart, I welcome Dr. K.V. Bennett Sir, Principal, Theophilus Training College, whose guidance and support helped the Research Wing to conduct many webinars and programs. Hearty welcome you, sir, to this talk series. Next, I would like to welcome our resource person, Dr. Alie Verghis, Assistant Professor, Peak Memorial Training College, Mavelikara. Today, she is presenting the topic, Managing Heterogeneity in Classrooms. We are really grateful to have you here this session. A warm welcome to you, madam, on behalf of everyone present here. Next, I would like to welcome Research Coordinator, Dr. Bindu ma'am, a kind-hearted personality with inspiring words. We welcome you to this session, ma'am. Finally, I extend a hearty welcome to all those who have joined in this program. Welcome all. Thank you.
Thank you, Soumya. The purpose of today's gathering is to discover the meaning of the concept managing heterogeneity in classrooms. We have an eminent personality to discover this concept. I invite Mrs. Sanila Manoj to introduce the guest for today.
Thank you, ma'am. Am I audible, ma'am?
Yes, Sanila, you are.
Thank you. Good evening, everyone. My assigned duty for today is to introduce our guest of honor. Welcome, everyone, to our 61st talk series. And our resource person for today is Dr. Alie Verghis, Assistant Professor, Pete Memorial Training College, Mavelikara. And our topic for today is managing heterogeneity in classrooms. Ma'am's qualification, achievement, and experiences are MSc, MEd, and PhD. She has 12 years of teaching experience, written many articles in peer-reviewed journals, e-journals, etc., acted as resource person in many webinars, wrote a chapter in an edited book, organized many seminars and paper presentation competitions for teacher trainees, presented many papers in national and international seminars and webinars. She has a great capacity for interacting effectively with the participants during the talk. Then she has the capability to handle any subjects, and she's a hardworking and socially committed person and many more to say. We are so blessed to have you, ma'am, in our Insight In-Depth Invited Talk series. Welcome and thank you so much for being here, ma'am. Thank you. Over to you, Zindu, ma'am.
Yes, thank you, Sanila. Before we get started, a few announcements and humble requests to all the participants. Kindly mute your microphones for the smooth conduct of the program. If you have any questions, please type them into the chat box. We will bring them up at the end of the session. E-certificates for participation will be issued, so kindly mark your attendance at the end of the program and share your thoughts and experiences through the Google platform. Now, I request Dr. Alie ma'am to share her views with us. Ma'am, the floor is yours.
Thank you. Am I audible?
Yes, ma'am.
Respected Principal, Dr. Bindu, Dr. Joju John, other teachers, students, and all other dignitaries present in this platform. Thank you very much, and a very good evening to all. Thank you for welcoming you, your hearty welcome and introduction. And I am very much happy to be a part of this wonderful program organized by the research wing of Matheo Phillips Training College. Let me get into my topic. The topic that I would like to discuss with you today is managing heterogeneity in classrooms. Let me share my screen. Is it visible?
Yes, ma'am.
Okay. Heterogeneity in classrooms deal with various aspects from the external appearance to the behavioral problems among children. And as teachers, we all know that children in a classroom show differences in their IQ, their learning styles, their socioeconomic background, shape, size, interest, aptitude, etc., and the like. But today, I would like to have a look into the differences in the behavioral aspects, especially with reference to certain behavioral disorders that may affect the learning process. We know that over the years, our teaching learning process have changed a lot. Today, it means coping with a range of learners. That is, managing our teaching learning process amidst differences. And classroom management is not only about control or discipline, but also about monitoring or encouraging group learning activities where students learn on their own. One-way communication in the past have given way to interactive roles for teachers. And teachers are no longer a sage on the stage, but a teacher is now a facilitator or a mentor by the side of the student. When we think about classroom management, it can be understood as having four different dimensions: physical setting, instruction, undesirable behavior, as well as rules and regulations to be observed in a classroom. So, classroom management means management of the physical setting of the classroom, management of instruction, which is mostly interactive, management of the rules and routines. And as a teacher, one may expect undesirable or disruptive behavior on the part of the students. So, behavior management can be considered as a part or an indispensable part of classroom management. Research says that a one size fits all approach is ineffective for most of the students, and even it may be harmful to some. So, we have to think about different ways in managing a heterogeneous class and should have a knowledge about some of the behavioral problems commonly seen in children. And that would help us to deal with the situation effectively. Now, we shall have a quick look at each of the three dimensions that I have mentioned earlier, and the fourth one in a little more detail. Regarding the physical setting of a classroom, as we always say, the environment of the class should be conducive to the learner. That means we have to ensure proper lighting, ventilation, cleanliness, and so on. And the seating arrangements for older students, usually we seat them in rows, and that helps in proper working of the class. And according to the different works allotted, for example, group works, when group works are given, the seating patterns can be changed. And there should be clearly defined routes and patterns for student and teacher movement, because we can't allow the students to jump over the benches or trip over the backs. Usually, sometimes we see these type of activities when we go to teaching practice schools. And also the teacher should be able to reach the student sitting at the remote corner of the classroom and monitor his work. And some movement on the part of the teacher is essential, because this may help to focus students' attention on what he is teaching or trying to convey. As a teacher, we have to arrange the classroom in such a way as to avoid hindrances in observing the teacher, in observing the blackboard, and also other exhibits. The teacher also should be able to monitor or see all the activities that are going on in the classroom. Another factor that we should consider is noise management. That is noise in the classroom as well as from outside, and nearby classrooms should be taken care of. Otherwise, the students may get distracted. These are the things that we can take care of about the physical setting of the classroom. Now, regarding the management of instructional activities, I know that these are things that we already know. I'm just trying to brush up your memory, that's all. We know that the learner should be kept engaged in the process of learning by a proper sequencing of activities. That is, we can, the easy and brief or easily attainable tasks can be interspaced with longer and challenging ones. And this will reduce disruptive behavior and boredom in children, and children will get motivated when they are able to attain something or when they are able to carry out something successfully. And the pace of instruction. The pace of instruction is best if it is brisk. But we have to keep in mind that all students may not be at the same level of readiness and they don't learn in the same way. So assignments and group work related to the material taught will help students to work at their own pace and also seek to the students need to be actively involved in making the decisions and modifications in their learning efforts. Therefore, we have to encourage initiative on the part of the learner and allow them to work ahead in certain units, to allow them to deliver brief presentations regarding their work so that they could benefit from reflecting on their learning styles and learning process. Students also need appropriate challenges, opportunities to explore their ideas. They need to learn to ask questions, to think critically, and to communicate effectively. So, give opportunities to construct meaning by interacting with peers, certain problems, certain issues, and also using the learning resources. Open-ended projects, peer teaching, use of technology, etc., will aid them in the process. Learning becomes more effective if concepts are learned in with reference to the context and related to existing knowledge and to emotional affects. Actually, students can't learn or apply their knowledge without emotional engagement because our emotional center of the brain is directly connected with the center for thinking. That is, thinking is clearly an emotional process. Therefore, activities that make them happy or emotionally secure or those with positive outcomes will hook them to the task. So we can use games, rewards, etc. Games like Edpuzzle. I think you are aware of that. There are a number of gaming strategies or apps that the teacher can make use of to engage and catch the attention of the students. Now, regarding the rules and routines to be followed, we can assign the students or ask the students to establish guidelines. Ask the students what they think is acceptable or isn't acceptable. And they could suggest rules for the academic year to be followed. Let them decide the rules. When they decide the rules, they will be obliged to follow the rules. And modeling ideal behavior is another way by which we can make them behave in the proper way. Demonstrate behavior, that is how to interact with others, how to respect others with others, and how to deal with others with dignity, how to speak politely. All this can be modeled in front of the students. And the procedures or clear guidelines for managing student work can be given to the students at the beginning of the school year itself. That is when and how to prepare and submit their assignments and so on. The procedure for the student to use the equipments and supplies, the lab equipments, library facilities, and other supplies of the institution can also be enlisted to them at the beginning of the school year itself. All the routines regarding waste management, time management, administrative routines, co-curricular activities, and how to document their work, etc., can be explained to them in the beginning of the school year. We can also write and paste these rules in the classroom, on the walls of the classroom, or the general rules can be given in the school diary. And student leaders can be appointed to see whether the rules are followed. All these activities ensure the proper conduct of the students or managing the classroom. Now moving on to the management of disruptive or undesirable behavior. When we think about disruptive behavior, it may range from minor inattention to interference with other students' right to work. Loud talking, conversation in between the classroom, teasing, passing notes, moving out of their seats, resisting to the teacher's instructions, not obeying the teacher's request, hitting other people. All these are types of disruptive behavior that can be shown by the students. If the problem is minor or not too disruptive, then the teacher may use minor intervention techniques, that is such as ignoring or moving close to the child, causing trouble, making eye contact with the particular person, or asking him to come back to his job, or verbally opposing his undesirable activities. If the problem persists or the behavior persists, yeah, or if it is getting serious, the teacher will have to resort to strategies that will have a lasting effect on the learners, such as isolation or giving bad marks or demerits, or otherwise the teacher can have a personal talk with the child, criticizing his bad behavior and explaining the logical consequences or specific prescribed consequences according to the rules and regulations of the institution that might follow. Now let's get a deeper understanding about some of the behavioral problems that cause difficulty in school to the learner as well as to others. First one is school avoidance. School avoidance is a disorder affecting school-aged children who, because of anxiety, depression, or social factors, avoid attending school because attending school causes stress to them. This occurs in about 5% of the school age children and equally affects boys and girls. It usually occurs between age 5 and 11. To solve or overcome this problem, we may have a talk with the child or parents to find out the real cause of the problem. And if we can't handle the problem, we may seek expert help from counselors or psychologists. Another problem seen among children is bullying. Bullying is intentional infliction of psychological or physical damage. And children may be involved as bullies or victims. Cyberbullying is also seen among teenagers. And this may lead to violent assaults and cause physical as well as emotional problems in victims and may even lead to suicide. Actually, when we ask why people bully others, we understand that bullying arises from a need to show power in some cultures or in some family situations. To show power, people, the husband or the wife or others in the family may be showing or maybe attacking others or behaving aggressively to others. And people who experience social rejection also may take revenge by bullying others. Home and society, school, as well as societal situations that are not warm and loving and that don't encourage the sharing of feelings, and those situations where discipline and monitoring are inconsistent, are perfect for raising bullies. To reduce bullying, what we can do is identify the cause of the problem behavior, identify the triggers for the child's behavior, the factors I have already mentioned, what may be the cause of this bullying activity, identify that, and clearly defining for the child which behaviors are desired. The child can be made known, or the child can be made to understand what type of behavior we expect from them and what is the right kind of behavior. As establishing consistent rules and limits of behavior in school as well as in home will try to reduce this type of bullying activities. As a treatment, psychotherapy is recommended, especially cognitive behavioral therapy is used for reducing bullying behavior in children. Sometimes a combination of medicine and therapy may be needed. Sometimes the problem will be overcome by counseling. Now, some of the other most common disruptive behavioral disorders are oppositional defiant disorder, that is ODD, conduct disorder, and attention deficit hyperactivity disorder. These three behavioral disorders share some common symptoms. So, diagnosis of these disorders can be difficult and time consuming. Moreover, a child may have more than one disorder at the same time. This is Arun, and his behavior, he shows the behavior of frequent refusal to obey his parents or authority figures. And he has a tendency to use drugs. He shows some kind of criminal behavior such as stealing, deliberately causing harm to others or destroying things, and he behaves often aggressively. All these are symptoms of conduct disorder. So, conduct disorder refers to a pattern of persistent antisocial behavior that leads to problems in school and society. Children with conduct disorder are often judged as bad kids because of their antisocial nature. Children with conduct disorder, as I told earlier, as we have seen the behavioral problems of Arun, they may not obey the parents or adults. They may use drugs. They lack empathy. They may be aggressive even to animals and show criminal behavior. They may also have a tendency to run away from home, and also they may show suicidal tendencies. Treatment for conduct disorder involves different types of therapies and training the child for managing his anger, managing stress, training for social skills, and also training. Excuse me? Am I audible?
Yes.
Okay. Management and training given to parents. Medication can also be given for different types of conduct disorders. This is another problem exhibited by children. This is Namita, and she is characterized by extreme defiance. She also refuses to obey rules and shows verbal as well as physical aggression, spitefulness, and deliberately she tries to annoy or aggravate others. This type of disorder is called oppositional defiant disorder. Around 1 in 10 children under the age of 12 years are thought to have this type of disorder, and often boys outnumber girls. As I told earlier, some typical behavioral patterns of such children are they easily get angered, annoyed, they show frequent temper tantrums, they argue with adults, refuse to obey rules, Physical and verbal aggression is shown by them. They have low self-esteem, low frustration threshold, and also they seeks to blame others for any misfortunes or misdeeds on their part. Treatment of ODD is more effective if it fits the needs of the specific child. All these disorders arise from certain needs of the child, and I shall explain about it later. And we have to identify those needs or the conditions that led to ODD in the child. Then only the treatment of these problems will be effective. So, to diagnose or identify the specific issues or what is causing that particular problem, a comprehensive evaluation is needed by a professional, maybe a mental health professional or a child psychologist, uh, such persons. And treatment include behavior therapy, as I said earlier in the case of CD, and also training for parents on effective ways, that is positive parenting strategies. Parents have to understand what the problem of their child is and also manage the difficulties faced by their child, try to understand their child properly and to strengthen the parent-child relationship. So here also a combination of training and therapy that includes the child, the family, and the nearby those who are near to the family are needed, as well as the school authorities should also have an understanding regarding the particular problem of the child. Now, another difficulty that we commonly know is ADHD, attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder has three different characteristics. First one is hyperactivity. These children may not be able to sit still for some time or concentrate on something. They show impulsivity. That is, they may act on an impulse. They may blurt out answers and do what they want without caring for others or the situation they are in. Another characteristic is inattention. They are not able to pay attention and may resort to daydreaming, and they often forget things and tasks. And all these symptoms are noticeable in classrooms. A teacher who is interested in the child can notice all these symptoms in the classroom. The child may be distractible, forgetful, procrastinating everything, anxious, acting impulsively, talking incessantly, losing things. The child may always be disorganized, and so on. What we have to understand is ADHD is a comorbid condition. It comes along with another symptoms. Mood disorders may be present, conduct disorder, oppositional defiant disorder, and some type of learning disability may be associated with ADHD. And what we have to understand is that, like poor vision or diabetes or any other disease, the disability caused by ADHD is also real, and it cannot be improved simply by the will of the child, or the child himself can't improve. We have to help the child. The child needs help to improve his situations. So the strategies that a teacher can use in the classroom are the teacher should pay close attention to the child. This can be done by seating him close to the teacher, or seating him away from windows or doors, that is from distracting factors, seating him near children who understand him and who could help him, and also removing things near him that may catch his attention. Another solutions are also there to help a child with ADHD. In the classroom situations, we can make the lessons very clear and interesting and use a lot of visual aids that would catch the attention, hold the attention of the child with ADHD. And he could be paired with students who would help him to be on task to complete his assignments. The teacher also may give certain cues or signals to come back to the activity when he's wandering off. And also we can give him time limit to complete the task. And this child may also be forgetful. I mentioned it earlier. So we can put luggage tags on book bag to remind the students what to take home from school. Otherwise, he may leave things in the school and forget things. We can allow or give them more time for taking tests. And I said he is very impulsive or active, so he may always tap on the desk and cause disturbance to others. So we may put sponges or mouse pads on the desk for the students who like to tap. And some hand exercises can also be given to reduce the symptoms of ADHD. Now, another problem that affects children is depression. Especially in the teenagers, depression is a serious medical problem. It is a persistent feeling of sadness or loss of interest in activities. It affects the adolescent child, his learning, his behavior, his feelings, and everything, and may lead further complex problems. It is a mood disorder, and this mood disorder can be treated. They can be given counseling and proper medicines. And as like ADHD, this problem also cannot be overcome with sheer willpower. They need help. So we were discussing about different behavioral problems and the factors. We have identified some of the factors that cause all these kind of problems in children. There are school factors that is ill treatment or discriminations on the part of the teachers or authorities or aggressive tendencies of other students. All these may cause these type of behavioral problems. There may be family factors, the type of family they are coming from, interaction or the atmosphere in the family, interaction between the members, the degree of warmth or love that the child gets from the family, some external factors that may affect the family, and so on. And there may also be some biological factors such as genetical factors and brain damage or some kind of accidents that cause brain damage and so on. And socio-demographic factors are there, low socioeconomic status of the child or the family, low educational level of the parents, and all these factors may lead to behavioral problems in children. So we should try to understand and figure out the cause of behavioral disorders before labeling a child as bad or unmanageable. And most important thing is that early identification and intervention of behavioral problems is very important in treating such children. Early detection is important because it paves the path for early intervention into the problem. And early intervention can improve the quality of life of the individual and also decrease the burden created to the family, society, as well as nation. Because these behavioral problems in childhood may continue to adolescence and later into adult life if left unrecognized and untreated. That is, the child may internalize these problems or turn inward, and turning inward may lead to anxiety, depression, or other mood disorders in the child, and also create some specific type of phobias in the child. Or otherwise, the child may externalize the problems, that is, moving outward, leading to aggressive behavior to others. They may show anger, violence, and other type of aggressive activities towards others, and finally end as a problem to family as well as society. Nowadays we hear about a lot of such problems. And also the consequences include sexually transmitted diseases. They may be open to rape, teenage pregnancy, other injuries, substance abuse, depression, I already mentioned, suicides, even suicidal thoughts, and even they may commit suicide. All these are different consequences of this type of behavioral disorders. Therefore, diagnosis and treatment is very important in the case of behavioral disorders. Sometimes we may need specialist services. A detailed study about the causes should be conducted to identify or diagnose a particular problem. So, specialists need to be involved, like pediatricians, psychologists, or psychiatrists, and different types of psychological tools can also be used. Different types of checklists are there, screening inventories, screening scales, assessment systems are there. All these can be incorporated in diagnosing the specific disorder that a child has, and after that we can treat the child. As already mentioned, the treatment of the behavioral disorders in children includes parental education. Very important, because teaching parents or making the parents aware of the particular situation of the child, how to manage the child, how to communicate with the child is very important. And sometimes family therapy may be needed, where the entire family is helped. All the family members are given training to improve the condition of the students and for problem solving about the different activities regarding the student. Another therapy is cognitive behavioral therapy, that is helping the child to control their thoughts and behavior. The child may not be in control of his behavioral patterns. Some differences in the brain centers or brain wiring may be causing different types of disruptive behavioral patterns. So some kind of therapy is needed to help the child to control his thoughts or behavior. Moreover, social training is needed. That is, the child should be taught important social skills, such as how to have a conversation, how to deal with others, how to play cooperatively with others, and the like. Now, the teacher's role in observing and identifying behavioral problems in children and reporting them to school counselors or school parents is very important. The teachers can observe the child incessantly and report the symptoms to the school counselors, make the parents know about the particular condition of the child. The parents may not be aware of such behavioral problems in children, and so we have to make the parents aware of that particular condition of the child and the need to get expert help or do some kind of assessment to diagnose the particular state of the child and to get help from others. Teachers may be asked to help in behavioral intervention. Sometimes experts may ask the teachers to carry over some type of behavioral interventions in the classroom so as to modify the child behavior and so on. So teachers may help in such kind of activities and thereby helping all students to achieve academically and socially. All the students with behavioral deviances can be helped to achieve academically and socially if proper diagnosis and intervention is made at the right time. Thereby teachers can change lives. So we are very powerful as teachers. So by understanding the different behavioral patterns of the students, different behavioral problems of the students, and intervening in their life at the right time, we may help to change lives. We may help to make people successful in their lives and overcome their difficulties. And with this, I am coming to the end of my presentation. Thank you.
Thank you, ma'am.
Thank you, ma'am, for that wonderful session. Now the floor is open for discussion. Ma'am has given us a very, very good talk. Something which has made us see how responsible we have to be as teachers. Thank you very much, ma'am. Now the floor is open for discussion. Participants, please participate in the discussion. There are many comments with very positive comments about the session. That was wonderful. It was eye-opening. Thank you very much, ma'am. Shall we move on, Bindu ma'am?
Any comments from the audience? Participants, please respond. And before that, thank you very much, ma'am, for your wonderful presentation. And I am very much grateful to you, ma'am, for being here today as the resource person. And also the topic is highly relevant. That is the managing heterogeneity in classroom, how to be in the classroom. That is, you presented it in a very impressive manner and the presentation was really a catching one. So on behalf of Martha Plus Training College, I extend my sincere gratitude to you, ma'am. And to participants, dear participants, any clarification you need from?
There was one question, ma'am, about cyberbullying, how to manage it, ma'am. Alie, ma'am, could you reply, please?
Okay. As we know, cyberbullying and cyber crimes are on the rise nowadays. Actually, we should not panic. What we should do is we should not panic. If we are on the right side, there is no need to get panic. So we can report it to elders. If we are children or youngsters, don't keep it as a secret or get tensed. We can report it to others, other people, our parents, or somebody who is in charge, and also get expert help. Cyber laws are there, and we can get the help of others to overcome such a situation if we are getting into such a situation.
Thank you, ma'am.
Ma'am, 17 ma'am. Ma'am. இங்க பாருப்பா 4 + 2 எவ்வளோ 6 + 4 எவ்வளோ 10 + 5 எவ்வளோ 15 பேலன்ஸ் 1 3 5 7 8 9 பாரு.
Excuse me, Ilavarisi ma'am. Kindly mute your audio, please.
Sindhu, shall we move on to the concluding session?
Yes, ma'am. Yes, ma'am. So with that, we have come to the end of the session. I invite Mrs. Smriti S. Pillai for the vote of thanks. Smriti?
Thank you, ma'am. Am I audible?
Yes, you are, Smriti.
Thank you, ma'am. Good evening, one and all. Respected principal, today's resource person, and all other dignitaries. And warm good evening. On this wonderful evening, I would like to propose vote of thanks for this gathering. First of all, I take this golden opportunity to thank our respected resource person, Dr. Alie Verghis, Assistant Professor, Peat Memorial Training College, for making this evening a valuable one. Ma'am has explained how to handle the heterogeneous classroom in a simple and effective way. Thank you, ma'am. Next, I extend my gratitude to our beloved principal, Dr. K.V. Benedict sir, for being with us. I think now he is not there. But all his support and guidance and strong and devoted guidance always help us in all our endeavors. Thank you, sir. Next, I would like to thank our research coordinator, Dr. Bindu ma'am, for all her support and guidance. It is also with pleasure I thank all the dignitaries, professors, research guides, teachers, and all other well-wishers who are with us. Next, I would like to propose my sincere thanks to all the research scholars, Adhd and Beard students to be part of this program. I would like to extend a special thanks to Dr. Ansi ma'am for all the technical support. Thank you, ma'am. Last but not least, I thank all of our secretary and all my co-research scholars. Thank you. Once again, I thank one and all wholeheartedly. Thank you all.
Thank you, Smriti. Thank you, everyone. We appreciate your presence and participation in this program. Kindly fill the Google form for the e-certificate, which is posted in the chat box. Let us now close the session with the national anthem.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गान